All right, Ashley, thank you so much for joining us and being willing to share all of your findings and talking to us for our Safe Cities project here in Atlanta. Can you tell us about what your job is, what it all entails?
I am the Assistant Deputy Director of the Georgia Bureau of Investigation Medical Examiner's Office. That basically means that I help the Chief Medical Examiner run the office, I supervise the non-medical staff, and I handle all of the administrative work.
Awesome. So I'm sure you see a lot of interesting things come through your desk.
Yes, definitely.
Now, can you tell me the need to expand them more?
Drug overdoses, as a general rule, there are in every jurisdiction a breakdown of what type of cases we have to bring in for exam. We always have to bring in drug overdoses because toxicology on the blood has to be run to find out what drugs may have been in their system. Since those all have to come in, that means that we have to do more post-mortem exams and more lab testing. So right now, for example, our office, we are expanding both our office space because we've had to hire additional staff and our cooler space to be able to store decedents for post-mortem exams because we're doing many more exams than we have in the past, and a large portion of that are drug overdoses.
Wow. Can you tell me some of the things that you have seen through the years, different overdose trends?
Well, I actually put together our drug overdose data every year, and what we have seen is just in general an increase in drug overdoses very consistently every year, as well as an increase in opiate overdoses. The most interesting trend that we're seeing right now with the opiate deaths is an increase in the illicit drugs as opposed to prescriptions. It's still primarily prescription drugs that we're seeing, but there is a significant increase in the amount of cases where either it's prescription and illicit or just illicit drugs.
Now, can you tell me, and anyone who's watching this, what qualifies as illicit?
Illicit drugs, and the way that we do it on our drug study is just drugs that cannot be prescribed by a doctor. So we don't necessarily look at if it was a prescription drug that was obtained illegally or illicitly. We don't consider that an illicit drug because we don't always know that. So we just focus on the actual drug. If it's something that can be prescribed by a doctor, it goes down as a prescription drug.
Okay, interesting. Can you kind of explain to me how heroin metabolizes in the body and how that would show up on your reports?
Yes. As soon as someone takes heroin, it breaks down to 6-MAM, that's 6-monoacetylmorphine. So that's an immediate thing. And then as it continues breaking down, it breaks down just to morphine. So when we are getting results and from our toxicologists, if we get morphine, we can look at that and look at the history of the case and see if possibly it could be a heroin death. We can also do tests for 6-MAM to see if that's there. If that's there, we know that it's a heroin death and we can classify it as such.
Okay. Can you tell me which age groups are being affected by opiates the most?
We have seen that stay pretty consistent over at least the last 6 years, that it is our 45 to 54-year-olds that we see the largest number of opiate overdoses.
Now, I know that your numbers, facts, but do you have any insight on why that might be?
As far as just that age group, most people that are in that age group have some type of prescription drug that just as you get older, you might need pain medications, and so we see people being prescribed that more in that age group.
Okay. Can you share, maybe some different drugs you see and through the years, how many overdoses they have caused?
Yes, I can. The drug that we see, at least in the last 6 years, that we have seen the most come up the most in our drug overdoses would be Xanax or alprazolam. However, that is not a drug that we generally see by itself. As far as drugs by themselves, we do see a lot of oxycodone deaths. Basically, Xanax and oxycodone kind of stay between the number 1 and number 2 spot on drugs that we are seeing in our overdose deaths. Xanax has stayed around 200 every year, and oxycodone is around 170 most years. What we have seen is fentanyl has definitely moved up. In 2010, fentanyl was our 7th most prevalent drug. In 2015, it was our 4th most prevalent drug. And it went from 78 deaths to 115 deaths.
That's a pretty dramatic jump. Oh, can you tell me why you guys do what you do? Why do you keep statistics on overdose deaths?
We keep statistics on pretty much all deaths so that we can identify trends, so that we can provide, like I said, to law enforcement and public health, so that we can let people know what we're seeing. So for example, with the overdose, we've seen a change in what type of overdose deaths we've had in the past 6 years, let alone the past 20 years. So we need to let people know that, so that law enforcement, so that hospitals, so that people know what to look out for. So we keep those statistics so that we can identify trends.
Okay. And what trends are you guys keeping your eye on in the last year or two?
Specifically in drug overdoses, we are keeping an eye on the increase in combinations of drugs, like we were talking about fentanyl and heroin together, and just at the increase in illicit drug use as well.
Okay. Ashley, thank you so much for taking the time to share all of that with us, all of your findings and facts for our Safe Cities project.
Thank you.